We all know that you need to breathe to survive, but did you know that how you breathe determines how well you live? It's estimated that 80% of people breathe incorrectly. Hi, I'm Dr. Michael Cuthbertson with Physio, and I'm going to talk about 2 ways in which we breathe that can dictate your quality of life. The 2 types of breathing are nasal breathing and mouth breathing, and you should be breathing through your nose both night and day, and here's why. When we breathe through our nose, we release an important molecule called nitric oxide. Nitric oxide is a strong vasodilator, or blood vessel expander, that helps to regulate our blood pressure. Generally, it helps to decrease our blood pressure. Additionally, nitric oxide has an important anti-inflammatory impact on the arteries. Also, whenever our blood vessels expand, we get better oxygen circulation and uptake into our tissues, especially our vital organs. We find that when we're nasal breathing, we improve our immune health, our oral hygiene, we decrease the risk of gum disease and tooth decay. We also improve our diaphragm function. Diaphragm breathing, we know, is really important for overall functions throughout our body, including the regulation of our autonomic nervous system. We balance out that fight or flight and rest and digest system better. And as I mentioned before, we need to be breathing through our nose day and night. When we breathe through our nose at night, it helps us to decrease snoring and decrease our risk of sleep apnea. Additionally, whenever we're breathing through our nose, we help to improve the overall health of our face and our teeth. Our craniofacial structures and our teeth have better alignment and they have better development. And then lastly, especially my role as a physical therapist, I find that nasal breathing broadly and globally affects our posture. It helps us to assume better posture and generally have our body and our musculoskeletal system feel better. So what happens when we don't breathe through our nose regularly? Well, whether we chronically are breathing through our mouth or intermittently due to some kind of sinus infection, cold, which creates congestion, or even something like a deviated septum or some kind of oral cavity issue, such as an issue with our tongue, and we're breathing through our mouth, all these processes are compromised. And in fact, our body, since it prioritizes getting oxygen to our tissues, especially our vital organs, will make all kinds of compensations. I regularly see people come in to see me with postural compensations due to mouth breathing. Those might include flattened neck, a forward head, rounded shoulders, this strong and really pronounced rounded thoracic kyphosis type of posture. I even see that they have really restricted ribs, especially if it's been going on for a long period of time. Additionally, people might have craniofacial issues, misaligned teeth, a really recessed chin. And I also find that this drives other issues and symptoms. Things such as headaches, even temporomandibular joint dysfunction can be the result of mouth breathing. I also see, in addition to these postural compensations, symptoms that go along with those: neck pain, shoulder pain, even low back pain. And then lastly, I'll find that even pelvic floor dysfunction, people who have been mouth breathers for a long period of time, will come in, and the driver of the pelvic floor dysfunction is the mouth breathing. So as you can hear, mouth breathing can create all kinds of adverse health reactions throughout our body. It can really create long-term things in our health that cause us to suffer. And nasal breathing is so important for our health for all the reasons that I listed, that we need to figure out how we can be continuous nasal breathers. Sometimes that's just being aware of the issue, and other times that's seeking help by those who can correct long-term problems in our systems. This information can be life-changing for you. And if you're finding you're having difficulty breathing through your nose and you suspect that you might have a structural issue, seek the help of a healthcare provider. And remember, your potential is within reach.